Hi, Dr. Scott Jensen here. Yesterday was sort of a banner day. Yesterday I received this correspondence, and it was written by Naomi Wolf. And she's a thoughtful author, measured and balanced from my perspective. And she had quite a bit to say about things that are happening in our country. But this really jumped out at me when she said this. It damages our country when we cannot tell truth from lies. This is exactly what tyrants seek, an electorate that cannot know what is truth and what is falsehood. Then she goes on, Naomi Wolf, to say this. The gatekeepers who lie to the public about the most consequential events of our time, and who thus damage our nation, distort our history, and deprive half of our citizenry of their right to speak, champion and choose without being tarred as would-be violent traitors, deserve our disgust. At the same time that I receive that letter, I'm receiving a letter addressed to Dr. Joseph Ladapo, the State Surgeon General for Florida. This is a letter from the Food and Drug Administration and the CDC. It's a 4-page document, and it's signed by the Commissioner of the FDA, Robert Califf, as well as the Director of the CDC, Rochelle Walensky. Both of them are MDs. I want to focus on 4 parts of this letter. I certainly hadn't planned on spending so much of my afternoon researching a response to this letter because I've frankly got my hands full preparing for the conference hearing I have with the Minnesota Board of Medical Practice in less than 2 weeks. But you need to hear this. This is to the Florida State Surgeon General, Dr. Joseph Ladapo. Dear Dr. Ladapo, goes on, and it says this. Focusing on adverse events in the absence of causal association and without the perspective of countervailing benefits is a great disservice to both individuals and public health. Like every other medical intervention, there are adverse effects from vaccination. Serious adverse events from COVID-19 vaccines are rare and are far outweighed by the benefits of these vaccines for every age group. The claim that the increase of VAERS reports of life-threatening conditions reported from Florida and elsewhere represents an increased risk, an increase of risk caused by the COVID-19 vaccines is incorrect, misleading, and could be harmful to the American public. Okay, let's unpack that just a little bit. First off, they're saying that there's no causal relationship. Well, I think it's been well established, not just over the last 3 years, but for decades, that oftentimes with an adverse effect to a drug or a vaccine, to establish cause is very difficult. Oftentimes we're left with associated time relationships. The CDC has come out and said that of the more than 20,000 deaths that have been reported in association with the COVID vaccine, some 20% were indeed deaths that occurred within 48 hours of receiving the vaccine. 20,000 plus deaths, 20% of that would be 4,000 deaths within 48 hours of receiving the vaccine. And most physicians, frankly, most pharmacists, frankly, very few people actually are willing or inclined to give vaccinations to people that are sick. We oftentimes say, why don't you wait a few days, get better, and then we'll give you the vaccine. In 1976, when the swine flu vaccine was suspended, that program, I think there were some 53 deaths approximately, and perhaps a couple hundred cases of Guillain-Barré. And that was enough to stop that vaccination program, and it was never restarted again. So for the FDA and the CDC to make a big deal about we haven't established a causal relationship, we know that. That's been understood by virtually everybody. But here's, I think, what needs to be said. I've got several articles that speak to this. This is the Washington Post, November 23rd, 2022, an analysis by Mackenzie Beard. She says, COVID is no longer mainly a pandemic of the unvaccinated. Here's why. And then she goes on to say this, 58% of COVID deaths in August were people who were vaccinated or boosted, according to an analysis conducted for The Health by Cynthia Cox, vice president in the Kaiser Family Foundation. And then she goes on to basically say this, the percentage of COVID-19 deaths in the vaccinated in September of 2021, so the program of vaccination would have been out approximately 10 months. In September of 2021, 23% of COVID deaths occurred in the vaccinated. In February of 2022, about 5 months later, 42% of COVID-19 deaths occurred in the vaccinated. And then 6 months later, in August of 2022, 58% of the COVID-19 deaths occurred in the vaccinated. That's in the Washington Post. That's what she had to say. A variety of reasons as well. Then we get another one. This is Monday, January 2nd, 2023, just a couple of months ago. And this one is from Rasmussen Reports. And it says this, nearly half of Americans think COVID-19 vaccines may be to blame for many unexplained deaths. And then it says this, their Rasmussen Report survey found that 49% of American adults believe it is likely that side effects of COVID-19 vaccines have caused a significant number of unexplained deaths. Well, that's in sharp contrast to what the FDA and the CDC is saying to Dr. Ladapo, where they are saying serious adverse events from COVID-19 vaccines are rare. They're basically telling, I guess, 49% of Americans that you're just stupid. This one, January 9th, 2023, in the journal Vaccine. I think this was a preprint. I don't know if it's been peer-reviewed, but it was in Vaccine. Surveillance of COVID-19 vaccine safety among elderly persons aged 65 years and older. Findings. Four outcomes met the threshold for a statistical signal following the BNT162b2 vaccination, which you probably remember is the Pfizer vaccine. These were the four outcomes that generated a statistical signal via what's called a rate ratio. Pulmonary embolism, acute myocardial infarction, which is a heart attack, disseminated intravascular coagulation, and immune thrombocytopenia, which is where your platelet count goes dramatically low because of an immune response. That is what Vaccine says. That doesn't sound rare. It says the early warning system is the first to identify temporal associations for pulmonary emboli, heart attacks, DIC, and idiopathic thrombocytopenic purpura following the Pfizer vaccination in the elderly. Then we have the Israeli Ministry of Health this month releasing a graph or data that generated this graph. And it basically says that if you look at the way the graph climbs, this is time from vaccination and it goes up, and this is deaths. The y-axis is deaths. But basically what it says is the death risk after a vaccine increased for the next 180 days in the vaccinated. That was Israeli data. So what we have here is a paragraph from the CDC and the FDA scolding Dr. Ladapo, and yet we have all this data that's absolutely telling a different story. Here's the second part of this letter I want to comment on. It says this, the FDA approved and FDA authorized COVID-19 vaccines have met FDA's rigorous scientific and regulatory standards for safety and effectiveness. And these vaccines continue to be recommended for use by the CDC for all people 6 months of age and older. Some key words there. Let me highlight them. Continue to be recommended for all people 6 months of age and older. And the reason is because these FDA authorized COVID-19 vaccines have met the FDA's rigorous scientific and regulatory standards. Okay, well, let's look at the next batch of articles. August 28th, 2022, about 7 months ago, the Wall Street Journal, new Omicron-specific COVID booster expected to be approved before the trial data is in, written by Liz Esley White. What it says is the Food and Drug Administration is expected to authorize new COVID-19 booster shots this week without a staple of its normal decision-making process. Data from a study showing whether the shots were safe and worked in humans. That's what's missing. Data from a study showing whether the shots were safe and worked in humans. Instead, the agency plans to assess the shots using data from other sources, such as research in mice. Quote from Dr. Robert Califf, Commissioner of the FDA, real-world evidence from the current mRNA COVID-19 vaccines, which have been administered to millions of individuals, show us that the vaccines are safe. What he's saying is, we didn't have the normal human trial data that we would have, but real-world evidence coming from those folks who have gotten the vaccine are enough to show us that the vaccines are safe. Different story than what they're saying in the letter to Dr. Ladapo. Then we have on December 17th, 2022, in the BMJ journal, we have the lead author is Naveen Shrestha, and the title of it is Effectiveness of the COVID-19 Bivalent Vaccine. This is data from the Cleveland Clinic. Summary, among 51,011 working-aged Cleveland Clinic employees, the bivalent COVID-19 vaccine booster was 30% effective in preventing infection. 30% effective. 30. Okay, that, I don't know if it really blends with what we're seeing. There's where it says that these vaccines have met FDA's rigorous scientific and regulatory standards. Then we hear from CNN, left-leaning, national news source, January 11th, 2023, Elizabeth Cohen and Naomi Thomas. Title of the article, FDA vaccine advisors disappointed and angry that early data about new COVID-19 booster shot wasn't presented for review last year. Well, what is that talking about? Well, you might be aware of Dr. Paul Offit. He's been a strong, outspoken advocate for vaccines for decades. This is what he said, quote, I was angry to find out that there was data that was relevant to our decision that we did not get to see, said Dr. Paul Offit. That rigorous scientific and regulatory standard that the FDA was speaking to. Then we have another article, the Wall Street Journal. New Omicron-specific COVID booster expected to be approved before the trial data is in. And again, I'd already mentioned this article. It says, from Dr. Robert Califf, real-world evidence from the COVID-19 vaccine show us that the vaccines are safe. In other words, telling us that they didn't need to wait for the human trial data. Then there's another section I think is quite compelling. This letter to Dr. Ladapo says that most reports to the VAERS, program, the adverse event program, represent a pre-existing condition that preceded vaccination or an underlying medical condition that precipitated the event. That's how they're explaining the VAERS data. Okay? Reuters, a Reuters article, January 13th, 23. The U.S. Centers for Disease Control and the FDA said on Friday that a CDC vaccine database had uncovered a possible safety issue in which people 65 and older were more likely to have an ischemic stroke 21 days after receiving the Pfizer bivalent shot, compared with days 22 through 44. They basically said an ischemic stroke is one that's generally caused by a lack of oxygen to an area because of a piece of plaque breaking off or a clot forming. And it's in opposite response to a bleed. So this would be more of a clot or a piece of plaque. But they're basically saying that people 65 and over were more likely to have an ischemic stroke. That's from Reuters. Well, in my practice, I had 2 patients, both females, both in their 70s, in good, stable health, who a while back both had strokes. We call them CVAs, strokes, 3 to 4 weeks after they received the vaccine. What am I supposed to do? Am I supposed to ignore that which I'm seeing in my practice? Then we see this from the FDA and the CDC. There is no evidence of increased risk of death following mRNA vaccines. I think that I've spoken to that issue. And then it says this. This is one of the last paragraphs in this letter. We agree, they're agreeing with Dr. Ladapo, that communication between patients and their healthcare providers is critical and fully support clear, accurate communication about the benefits and risks of medical products. It is inaccurate to suggest that the federal government will retaliate against any healthcare provider for communicating with their patients about the benefits and risks of a particular medical product. I'm sorry, but Mr. FDA and Mr. CDC, when you tell me that the federal government won't retaliate, and I read what I've read from the Twitter files, and I see what I've seen in my own personal experience with 18 different allegations and 6 different investigative letters from the Minnesota Board of Medical Practice, I don't think that quite rings true. When you talk about communication between patients and their healthcare providers being critical, and that you fully support clear, accurate communications. And then I look at this document from the National Governors Association, October 19, 2021, COVID-19 vaccine incentives. This is what the National Governors Association was doing to try to get people to take the vaccine. They're incentivizing it. In Alabama, you got to drive on the Talladega Super Speedway. In Arkansas, lottery tickets. In California, cash prizes of $1.5 million each would be potential in a drawing. Colorado, the Department of Corrections announced provide $500 to any more of its 6,000 staff members who get fully vaccinated. In Connecticut, Drinks Are On Us campaign. In Delaware, Delawareans 12 to 17 who receive a vaccine will be entered into a raffle for a full scholarship to a Delaware university. Or you could have 4-day vacations at destinations in the lottery. There's another one, the Dover International Speedway. Evidently, there's a lot of fast driving going on. Here's another one in, I guess this is Delaware also. Maybe not, maybe it's another state. Round trip tickets to anywhere that American Airlines flies. Here's Maine, fishing license. And then near and dear to my heart, Minnesota. Incentives to get your vaccine. Fishing licenses, amusement parks, fairs, $25 Visa card, state park passes. Snopes, you know, the fact checker, they came out. There was a statement made that Tony Fauci had participated in gain of function research. So Snopes come out and says this. They're going to investigate the notion that Tony Fauci helped fund gain of function research. They come in with their report and they say, unproven. And here's what they say. The claim that Fauci is responsible for the COVID-19 pandemic is based, and it goes on. That wasn't the question. The question was, did Tony Fauci participate in funding or endorsing gain of function research? Snopes demonstrates its bias by jumping to the idea that the claim is that Fauci is responsible for the COVID-19 pandemic. That's a whole different claim. And then we get the NNT, you might remember that, I've talked about it before, the number needed to treat in order for a certain outcome to occur. Well, this is data, January 25th, 2023, from the United Kingdom, United Kingdom Health Security Agency. And this is a couple of graphs, and it's the NNV, which is the number needed to vaccinate in order to get to one person acquiring the hoped-for outcome. So in this situation, it was, what is the NNV for prevention of severe hospitalization for 5 to 11-year-olds if they get the primary series? So this is talking about 5 to 11-year-olds getting the primary series of COVID vaccines, which would be for the Pfizer or the Moderna 2 vaccines. So 2 shots, that's the primary series. What's the NNV? How many people need to be vaccinated in order to prevent one severe hospitalization? The United Kingdom data shows that the NNV is 112,200. What does that mean? That means that 112,000 people have to be vaccinated with that primary series, 2 shots from Pfizer or Moderna, in order to prevent one case of severe hospitalization. Does that sound like it's consistent with what the FDA and the CDC are saying regarding clear communication between patients and their healthcare providers? Folks, when I read this letter, I had to put it down because it was so stunning. I thought, is the date right? And so I looked again. And the date is March 10th, 2023. The CDC and the FDA are putting a letter out to Dr. Joe Ladapo that I think that within a matter of days, weeks, or months, they may be forced to retract in part. I would love to see Dr. Ladapo or someone else post the entire letter on social media platforms so you can all read the entire thing. I've just shared snippets because that's what I feel most comfortable doing. I applaud the work and the voice of Dr. Joe Ladapo. I'm stunned by the perspective that the CDC and the FDA is sharing on March 10th, 2023, after all that we've seen. Literally daily, weekly, or monthly, we are seeing data come out showing that it's an entirely different picture than what we'd been led to believe. That's why people like Naomi Wolf are saying, what in the world is going on? Astonishing. It may well be the CDC and the FDA are caught in some sort of time warp in the past where somehow they did not get updated. Thank you for listening.